Good evening, everyone. Welcome to our conversation on queer and trans people of color and mental health. I'm going to start by giving a brief overview of this program so everyone knows what to expect. I'll begin by introducing who is in the room, myself, and our guest speakers. After our guest speakers are introduced, they'll each share some resources they recommend for LGBTQ people of color. I'll ask a few opening questions to our guest speakers to start off the question and answer segment. After these questions, we'll begin the live question and answer segment of the program where you can ask your own questions. This will be from around 5:25 to 5:50 p.m. We'll wrap up live questions at that point so our speakers have the last 10 minutes to offer their closing remarks. First, allow me to introduce myself. I'm Lena, the LGBTQ Services Librarian at Newark Public Library. I use both they, them, and she, her pronouns, and I've been working at NPL since 2019, but only recently entered the LGBTQ services position in the past couple months. If you attend other queer programming, you'll probably see me there. Our first speaker is Lazora Jordan. Lazora is a mental health clinician. They use an intersectional approach to trauma-informed therapy and an anti-oppression approach. Our second speaker is Alex Lee. Alex is a clinical social worker at MA General Hospital. He's an advocate, liaison, and coordinator for patients experiencing acute mental health challenges. Thank you both so much for being here. Now, let's hear about the recommended mental health resources for queer and trans people of color. Lazora, would you please talk about the resources that you recommend?
Absolutely. So health is always holistic. I included resources that look at different components of what we need to live a healthy life. So essentially not just mental health, but also physical, social, emotional, etc. So I started with the Newark LGBTQ Center. They host events where you can get a sense of community. It's a great chance to get to know other queer folks, and that can open up doors to finding out about other resources that people have used, but also connection is always important. You can see I've got a few counseling service resources on here as well, like cooperative counseling, Hedrick Martin Institute, and CPC Behavioral Health Care, University Hospital in Newark, that's going to look at probably more medical transitioning, medical support, etc. It's really important for queer folks to have access to knowledge, whether it's learning about their sexuality, learning about medically transitioning, or just even getting a chance to talk with somebody about, well, I'm considering these things for myself. What does that look like? And then La Casa Don Pedro, also a chance for folks who are Latinx or Latina to be able to talk with, again, wraparound services, but also being able to access mental health services.
Awesome. Thank you so much for all of those. Alex, would you want to explain your resources next?
Sure, thank you. So I guess I've assembled some more website links to, for those of you who might, want to engage in a different form of media than maybe calling, in addition to what Lazora has shared here. So first we have the National Queer and Trans Therapists of Color Network. This is a service that connects QTPOC therapists and clients. A lot of times in our experiences, it's been such a struggle in finding a therapist who is white or cis or just really doesn't understand, where we're coming from. And more on that later, but to be able to connect with someone who, right off the bat, just like at least on some level understands some of what it feels like to be marginalized in more than one dimension. And I think that brings us also to the Loveland Foundation. And its goal is to improve access to therapy. Although right now, my understanding is that they're currently closed for applications. A lot of therapy is in a bracket of payment that is not something that people find accessible. So even if you have like a really great therapist out there, there's an additional hurdle. Do they take my insurance? Do they, is there any difficulty I have in having insurance, period? Will they see me out of pocket? A lot of questions there. There are community organizations that might be more local than the Loveland Foundation who can strive to bridge some of those gaps as well. I'm not as intimately familiar with the with resources in New Jersey, but that's something that I recommend that people can look into, and Lena might be able to help with some of that search perhaps as well. Rest for resistance is, keeping to what Lazora had just shared about this being a really holistic approach, recognizing that art is a part of mental health as well, and learning about the stories of people who've gone, through really tough experiences. It's got a number of articles, poetry, other forms of artwork, and the editors, I believe, are all trans people of color, and really speak to areas of overlapping marginalization. So lest we forget issues of disability, what it means to be marginalized for, being a sex worker, other areas. Those are things that are centered in these narratives, and I recommend them to your attention. Since I work in an acute mental health setting, one of the things that we see is patients who come into the inpatient hospital after they've been sectioned or pulled from the community, often against their will, because they're deemed to be unsafe by someone in a position of power. Most frequently, those people are police. And recognizing that amongst communities of color, calling the police is so likely to lead to harm, particularly for Black folks, and that various communities have banded together to create alternatives to calling the police for someone who's in mental health crisis but is also not safe to be around necessarily. So this site actually has a Newark specific set of resources, and it also not just for coming into the hospital, but also for things like housing or shelter or substance use, something to check out there. And then finally, the hospital I work at, Mass General Hospital, has a list of mental health resources for Black, Indigenous, and people of color. It's not specifically targeted at queer and trans individuals, but it's got a lot of organizations that work to meet and center our experiences. So yeah, that's that.
Thank you so much. So many good resources. And definitely, I will compile all the resources that both of you have contributed and make like a web guide out of it. So if anyone watching would like that list afterwards, please feel free to email lgbtq@mpl.org, and I will send that to you afterwards. So that was awesome, both of you. Thank you so much. Now we can start on some opening questions. And just for simplicity's sake, with each question, let's have Lazora answer first and then Alex. And so my very first question, how and why did you get involved in mental health care work?
Thanks for asking. I got involved for a multitude of reasons. So I'll start with the how first. So I am a licensed social worker. I went to School of Social Work for graduate school. I got my master's in social work, and I immediately after that started working as a therapist in a federally qualified health center. Federally qualified health centers are really great resources. Because oftentimes they don't turn away people for the inability to pay. And they oftentimes have not just medical services, but also mental health services, and can connect people with other resources. Why I got involved in mental health. Mental health is so important. I've been able to see the effect of it, not just in my own life, but in the lives of people around me. And when I say mental health, I'm talking about both healthy and also things that we wish could be better. It just like you would go to a doctor, I think it's important to go to a therapist. And as a person with several marginalized identities, I'm fortunately, there's a lot that we have to deal with. And so to be able to get some support in doing that, I think is really important and an act of resistance to oppression. And also just to be able to as well have a sense of, man, if I need to get a better sense of who I am, or if I'm figuring out some things about my identity, if I want to explore things about my career path, mental health can be those things as well. So it's really important to me to destigmatize mental health, to make it seem just as ordinary and no less looked down upon than going to the doctor's office, or if you have a mental health disorder, that shouldn't be looked down upon any more than having a cold or the flu.
Thank you. Alex, would you want to contribute some thoughts to this as well?
Sure. So like Lazora, I'm also a social worker. I also went to graduate school and graduated a couple of years ago with a social work degree. And in that sort of general process, I was really struggling a lot with, a lot of the curriculum, and finding that, a lot of the materials for mental health work weren't really things that I would find accessible or applicable, or things that would even, turn me away. But I think, started down this road as I, in college, I was, sort of a student mentor to people who, had a lot of different kinds of challenges in their lives. They might be first generation college students. They might be folks who, have mental health crises, and then also confronting my own mental health difficulties, and recognizing and owning that over time has sort of propelled me along. So it's, some combination of seeing how I've needed it and how it's been beneficial to me, and also to my friends and family, and also what happens sometimes behaviorally when mental health doesn't get attended to, things that make for really challenging behaviors between people in close proximity to each other.
Yeah, absolutely. Thank you. So this next question sort of goes more into, some personal background. How has your individual experience as a queer person of color influenced your relationship with therapy and social work as both resources and as professions?
So again, as a person with multiple marginalized identities, at some point I made a choice to say, nothing is going to be more valuable than my mental health. I've always valued health in general and well-being. And I think that's really important for folks with marginalized identities to strive for. And, unfortunately, there's this pervasive image that, people of color don't want to engage in mental health work. And that's simply not the case. I think more and more people are recognizing the need to have access to therapy services. I think, honestly, access to mental health services should be a right for everyone, regardless of citizenship status, regardless of ability to pay, regardless of employment or ability. And that's something that really informs my work for therapy. I think that prioritizing our mental health is an act of resistance, and there's also an act of survival. Very important. And I bring that lens to my work.
That's such a great answer. Thank you.
I guess for myself, I'm thinking about like all the times that I've been to therapy, or even just spoken with therapists, and struggled with how much energy and time goes into explaining the basics, and how often I have found myself in a position of having to educate a therapist around elements of what it means to be queer, or what it means to be Asian, and it feels like they're learning from me, but I'm paying them, kind of a thing. And that has made it challenging for me initially, at least, to feel that, a therapist was even like appropriate for me, because I just didn't feel like I was, making a connection for a good long time. And, as I came to an understanding, and as, more and more therapists of color continue to grow in the profession, this becomes less and less of an issue, I think, or at least less and less inaccessible of an issue. But it's also made me really want to stay in the profession, realizing that, I'm not the first, but I don't want, I want to make sure that there are more of us out there, continuing to build bridges for each other.
Absolutely. Thank you. So this next question is a more practical question for people watching. How can someone find a therapist or social worker who is also a queer or trans person of color? What would you recommend? If you're just starting this search, maybe you haven't, reached out to a therapist or social worker before. What would you say to those people for how to get started?
It can be a challenge, but we are out there. So there are a variety of ways to look for a therapist, and to find one who self-discloses their identity as a trans or a queer person of color, that may be a bit harder to see on someone's profile than not. A lot of times therapists may not disclose certain identities outside of what's readily visible. And you may just have to meet someone in person in a session. And even then, they may choose not to disclose it. It varies from therapist to therapist. But some things that are recommended to look at: resources like some of the ones that Alex provided, resources that talk about these are services and places to go to for queer people, for trans folks, for people of color, for people who share all of these identities and more. Other places to look are places like Psychology Today, or if you're going to a platform like Better Health, or if you're looking at any other profiles, a lot of times either places that provide mental health services or individual therapists will talk about the different issues that they address or communities that they support that are in their profile. Communities that they support in their profile. And just because someone doesn't list it there doesn't necessarily rule out the fact that they support it. What I always recommend, because you can even get in front of a queer trans person of color who's a therapist and may not be a good fit for you, always meet with that person, give it a few sessions, talk with them openly, especially in the first session. This is what I'm looking for. This is what I'm hoping to change or explore about my life. This is what I need, and that be an ongoing conversation. And if it turns out that that therapist is not a fit for you, that is okay. It is okay to say, I don't think that this is quite working for me. I'm going to try to seek services with a different therapist. It doesn't mean that you're a bad person. Doesn't mean there's anything wrong with the therapist. It's like flavors of ice cream. Find what works for you.
Thank you. That's all great advice. Alex, do you have anything that you would like to add to that?
That was basically hitting the nail on the head. I so strongly agree with that last statement, that, just because a therapist has those areas of overlap in identity is not necessarily a guarantee of good fit. And sometimes, depending on what you're looking for, you might actually be looking for someone who's not overlapping in identities. Maybe there's maybe the community is too small. That's just something that we have to openly acknowledge, depending on where you live, geographically. Like if sometimes it's like, all right, if I live in a smaller town, I might see this person in my personal life in a lot of different ways, and it would be really uncomfortable to have them be my therapist. So those are just things to bear in mind, depending on where you live and what kinds of social constraints might exist, as well as the goodness of fit that Lazora mentioned. Absolutely.
That's a really good point. Thank you. So This next one is also a practical question. And I think that this sort of ties in to what you were saying, Alex, about like, making sure that your therapy and your, actual like life outside of that doesn't overlap in a way that's uncomfortable. So this question is, how can LGBTQ minors access therapy or talk about their identity in therapy without parents or other adults in their life finding out about it? Can you speak a little to confidentiality and therapy and, just safety of, queer and trans minors?
So I'll start by saying that when you first go into a session with a therapist, usually we'll talk about the limits of confidentiality. Typically, those are if someone is at immediate risk to a danger to themselves or to someone else, or if there's talk of a minor being harmed. A therapist should always give you an indication if there's something that they have to report or a place where they something where they have to break confidentiality. And also things vary from the laws vary from state to state, especially when it comes to minors. If you're an adult, that's a different story. Things are going to be almost uniform around confidentiality there. If you are a minor who is interested in seeking therapy and you're thinking, okay, well, if I'm concerned about my parents or other adults in my life finding out the information I divulge in therapy, a lot of times there are things that are covered within confidentiality, and you should ask the therapist what would not be covered. And that's because there may be some difference in approaches about what a therapist may share, but they really, in general, therapists will protect most of the information that people divulge in therapy. If you were interested in getting therapy in general without your parents finding out, one thing to look at is, okay, well, if I don't have access to insurance, let me try out this individual therapist or go to this particular organization and see, do they provide a sliding scale fee to pay out of pocket? Whether you want your parents to find out about therapy or not, you can also ask, okay, well, when it comes to my session notes, is it possible to leave out certain things from the billing so that the adults in my life cannot find out? Those are all very important things.
Thank you so much. Yeah, those are all really important points. Alex, do you have anything that you would like to add to the subject?
I actually defer to Lazora's expertise on this. Since I'm not working as a therapist right now, I have a little less insight or a lot less insight on this. But yeah, I think that as far as confidentiality goes, the only thing I would consider adding would be that you can be very upfront in asking your therapist about what is and is not going to be shared when you first meet them, in terms of matters of identity, or you can ask them maybe what the laws of the state would be around that kind of disclosure. Sometimes those things can take place in kind of a screening interview before you've even sat down for a session. So they wouldn't even necessarily have session notes. You wouldn't be formally a client. You'd just, in some sense, be figuring out if they're a good fit for you, depending on what is the requirement within each state.
Thank you. I appreciate that. And Lazora, did you have something else to add?
Yeah. The other thing that comes into play with minors and accessing therapy is your age. So in some states like New Jersey, things are different when you're 16. And you being able to provide consent for certain things around your private patient health information, and also consent to take on certain services. So that's a consideration as well.
Thank you. So this question, I think, you touched on a little bit before, but, maybe to circle back and talk about this a little more, what are people's options to access mental health care if, for example, they're undocumented, or if they don't have access to a bank account? What are the possibilities? What are the options available to someone in one of those situations?
Again, this is one of those things that is unfortunately and admittedly challenging, but not impossible. There are a lot of therapists, especially if they're social workers, based off of our code of ethics, that may consider offering a sliding scale fee. Federally qualified health centers is another option for that. And also going to organizations that provide services to folks who are undocumented specifically, or focus on providing services to our immigrant communities. That's a great place to see if they have resources, if they don't have mental health services on site directly. And another thing that I will also add is language. So if English is not your first language, even if you speak it perfectly well, when we're talking about our experiences and our emotions, it can be really challenging to function in what's not our primary language. And so you do have the ability and the right to ask your therapist, can we use a translation service? Many sites have access to that. So this way you would be able to talk in your primary language while accessing therapy services.
Thank you. That's so important. Alex, do you have any further answer to this question?
Not necessarily that much more. I guess since mental health care, speaking broadly, not just speaking, for therapy necessarily, and for people in acute like mental health crisis, there is the option to go to hospitals for care. A lot of them, well, I should say maybe this differs by state, but in Massachusetts, you don't have to have insurance. You don't have to be documented to come into the hospital for mental health treatment. And sometimes, as stressful as it can be to go into the hospital, a social worker in the hospital can also help you with navigating that resource or that range of resources, because a lot of the problem solving that takes place while you're in crisis can be really, really hard to do, especially while you've got other things going on. So that's certainly one thing to consider. And then that thinking expansively here, that there are areas in which mental health care may not always be what's professional or professionalized. And so there are, arrangements that, sometimes people can, create that look very different than, traditional fee for service models. So yeah, that's about it.
Thank you. That's really helpful. So this one, has to do with a more specific, need, but I think it's really important. What kind of therapy do trans people need in order to start the legal or medical part of transition? There's a lot of, what is considered, medical gatekeeping of trans healthcare, and a lot of that ends up, requiring people to go through some level of therapy. And I was wondering if you could speak to that for anyone in the audience who is trans and, doesn't quite know where to start, but they know that therapy is involved.
So one thing I'll say is accessing Planned Parenthood is a good resource in many communities where you can talk with the social worker on site there, even if you're not engaged in therapy specifically or mental health care. And that's oftentimes for many trans folks a place where they get started to say, okay, well, how can I start this process of medical transition? Another thing is, again, where it can be somewhat challenging is you may need to look up specifically therapists that are working with the World Professional Transgender Healthcare Association, right? And being able to provide certain assessments. So oftentimes you can go to a hospital and not be engaged in therapy specifically to start that process. So there are multiple ways to do it. You do need a letter from a therapist to be able to engage in medical transition processes. in a lot of places. And so being able to talk with a therapist to see, okay, is this within your scope of practice? Unfortunately, there's not unfortunately, but a lot of therapists have different specialties. So someone may provide a specialty in working with a certain range of issues or working with a certain set of populations. And they may be great in that area, but not work specifically in a different one. So you can always reach out to a therapist. A lot of therapists will either have an email or a phone number where you can call the center and say, is this something that you can help me with before engaging in care?
Thank you. Alex, do you have anything to add?
No, just seconding Planned Parenthood as a thing, and I don't know that like every hospital has necessarily like a trans health clinic, but they can be a good initial stop for a lot of these questions and associated questions as well. I think the legal piece really does differ a great deal from state to state, and sometimes it might just be as easy as putting in an application, but I'm not as clear on this, I think.
Thank you. So thank you so much both for all your thoughtful answers for those opening questions. Now we're going to transition into the live Q&A segment of the program. So let me start off this segment with some ground rules to make this an effective and respectful conversation. So in this space, we're prioritizing questions from people of color who identify as lesbian, gay, bisexual, transgender, queer, two-spirit, women-loving women, men-loving men, asexual, aromantic, pansexual, non-binary, or gender non-conforming. This also includes people who may not identify in these ways but find solidarity with these movements through also being targeted or oppressed by white, cis, hetero, patriarchal systems. If someone is watching right now who is a person of color and isn't currently identifying as LGBTQ, but is questioning if they might be, this section is for you too. If you're a person of color who's engaged with romantic or sexual relationships or situations with people of the same gender, but haven't labeled it, the section is for you too. If you're a person of color who transgresses cultural gender roles and rules, this section is for you. And if you're a gender that exists in your culture but is erased by the white Western gender binary system, this section is absolutely for you too. We do ask that people present who are white and people who are straight and cisgender, please refrain from asking questions here so that queer and trans people of color present can ask all of their questions first. If there's time at the end, we'll open the floor to others. And if there's not time, you're more than welcome to email your questions to lgbtq@npl.org, and I will respond to you as soon as possible after the program. So if you are interested in asking some questions, there's multiple ways to do this. I wanted to make this as accessible as possible. So if you would like to speak, you can raise your hand in the Zoom, and I'll enable you to turn on your audio. It will probably appear on your screen as a request to turn on your audio or on your mic. And when you agree, then you can ask your question. You can also type your question in the chat if you prefer. If you choose this option, I'll read the question to the speakers. If you want others in the chat to be able to read your question, then select all panelists and attendees. But if you only want the panelists to be able to read it, you can select all panelists. There's also an option to ask questions anonymously. If you don't want your name tied to your question, if maybe you're closeted, I wanted it to be safe for people to ask those questions too. And so for that, you can go into the question and answer part of the Zoom, and there's a box that you can mark when you're asking your question for it to be listed as anonymous. And so I will be checking that as well, and I'll read those questions as written. So yeah, and so we're officially opening to questions. So please, for the folks attending, please feel free to ask. Open space. we could, I suppose, keep chatting until some questions come in. Maybe people are a little nervous. I'll leave that up to Alex and Lazora.
That works for me.
Sure. Did you have any other questions that you had in your back pocket, Lena?
I mean, I am always, you know, something that I've certainly dealt with is, you know, sometimes with therapists like listing, you know, their populations that they work with and who they're allied with. You know, I've noticed sometimes people will add LGBTQ, but when I actually like have that first session with them, it's like clear that they're not super familiar, you know, with those issues. And, you know, I'm curious if you have any, you know, experience or advice with sort of, you know, figuring out, I guess, to what extent, you know, like figuring out sort of the motivation behind why people have listed, you know, certain groups when they don't necessarily, you know, have a lot of experience. They just like, you know, don't feel like actively hostile. And so then they just like slap it on there. I don't know.
Are we using the same format? Because if not, Alex, feel free to go first.
Okay. I'm still pondering. Yes, I think your observation is absolutely on point, that there's a lot of therapists out there who will tick either you know, specialty working with LGBTQ population, or specialty working with different racial groups, or whatever form of marginalized identity, and then turn out to not actually have that kind of expertise. Or it's, you know, sometimes it might just not be a good fit, but a lot of times, you know, I've found exactly as you've said that maybe it's not been as good of an experience because they're claiming credit in an area that they don't necessarily have either lived experience or a lot of client experience working in. And honestly, I don't know if I have a good answer as to how to vet that, because a lot of places like, say, Psychology Today, you can just kind of tick those boxes and then they'll show up on a search. But what I sometimes will pay attention to is how much they center narratives around that in their personal description or on their website. And I find that, you know, people who don't just say, oh, I work with this population, but are, you know, either have some experience working in those kinds of agencies, whether they have some amount of self-disclosure, you know, whether they explicitly name, you know, which marginalized populations they center in their practice, that usually makes it a more likely to be safe environment, but it's not a perfect method of assessing.
Yeah, to add to what Alex was saying, and yes, Lena, this is such a great question. What I've seen is a lot of times people will add those things on their profile as these are populations that I work with. And that doesn't mean that they have an expertise in them. And what I think is what's going to be tolerable, or what's going to be a good fit, or what's going to feel okay for one queer or trans person of color versus another can vary. And so some people may be okay with someone who doesn't have as much expertise or knowledge or experience, but who is open, and the therapist who says, I'm here, I'm going to follow your lead. You're the expert of your own life experiences. And so I'm really going to work with you to be supportive of you, to work with the specific mental health challenges that you're experiencing, while also keeping an approach where I'm learning and listening a lot about the lens that you're bringing with those individual lived experiences of oppression, whether it be for sexual or gender identity or around racism. Yeah, and so that's a challenge, right? And so other people may say, well, I want someone who I don't have to explain anything to. And that is completely understandable and oftentimes an ideal experience for someone. And even then, none of our communities are monoliths. We have different parts of each of our communities that we're a part of, where people may feel differently or taking a different approach to things. Not even everyone takes the same approach to oppression around sexual identity or gender orientation. Gender identity. Not everyone takes the same approach to oppression around race or ethnicity or even class. And so being able to find somebody that, again, that has that personal fit is really important. And I'll say that, like if somebody claims to be an expert around oppression, it's something to keep an eye out for. I think that oppression is something that we're always learning about. And my personal approach is we always want to stay in a place where we're saying, I'm still learning, always learning about oppression, because that's how we dismantle it.
Thank you so much.
Strongly agree.
So I still have not gotten any questions in, but I was actually wondering if either of you have any questions for the other.
Oh man. Well, Lazora, I'm just only starting to get to know you today. But I'm wondering if, as a social worker, we often work in multiple settings before we even set out on our kind of career trajectory. How have your past experiences informed the work that you do in therapy?
Yeah, absolutely. So my past work experiences are working at organizations that primarily serve people of color, specifically Black and Latina folks, and working not just with Black and Latina folks, but working with folks from these populations that don't have the greatest economic privilege. So maybe living in areas that are under-resourced. I intentionally wanted to work in that setting because I think that, again, mental health care is a human right. And I know how important it is for so many folks to have someone that looks like them. Me taking my anti-oppression lens and approach to therapy, I really wanted to make sure that people who share identities with me, people who are marginalized, even if they don't share identities with me, have access to that.
Thank you.
A question I had for you, Alex, is some people may decide that, hey, I not only want to access mental health services, but eventually I want to be able to provide this to other folks like me and be out there for the people. So I wanted to see, just get a sense of what your experience has been like as being a queer trans person of color in the field.
I think about where I'm at right now, like having just made it through grad school and realizing that like I would not have been able to do it without friends and connections made along the way, Lena being one of them, of course, even though we didn't go to social work school together, being able to support each other in different experiences, that's been a big piece of it. And just, looking for, for your people or people who will listen to you. Is a big part of surviving that experience. I think a lot of the education around social work and other mental health professions can be very white Eurocentric. And I sometimes say that, we do 3 times the amount of work that, white clinicians might need in order to just get through school. The first is learning, what they're telling us to learn. Second being, figuring out the ways that doesn't that does and doesn't fit for ourselves, and then unlearning that and, coming up with an entirely different or highly modified anti-oppression approach in order to really deliver good mental health care to people who have backgrounds similar to ours. And then, as you were just saying, Lazora, just like staying humble, keep learning, realizing that like today I may feel at the top of my game and feeling like I have the answers to everything. And then tomorrow I may realize, oh my gosh, like what I said was so, horribly oppressive and rooted in areas of, hierarchy and oppression that I had never even thought of. And, I feel like I always am continually learning from clients, from patients, from colleagues, from the community. Everything I read, everything I experience, it's an ongoing shaping process. And what's going to look like good care 20 years from now, I hope looks very different from, what we think is good today.
So we've got a question. So I'm going to read it to y'all now. It goes, "Hi there, I jumped in a bit late, so I think you already partially covered this question, but I have a friend that's been trying to get a letter from a therapist for top surgery in New Jersey. They're young and on their parents' health insurance and having a hard time navigating the healthcare system on their own and don't have the best support from their parents. They did recently start hormones at Planned Parenthood, though. I believe their own therapist said that they can't provide the letter, unsure about the circumstances. And another therapist they started to see said that they required seeing patients for 6 months before providing a letter. Would Planned Parenthood or elsewhere be a good place to start looking for a therapist that could provide a letter for top surgery? Or does it take as long with all therapists to do this?"
That's a great question. So a lot of what therapists do is assessment. And when it comes to something as monumental as gender identity, that 6-month timeline is a really good one. I can't say that I know whether it's a standard timeline. Unfortunately, yes, it does suck for the person experiencing that. Your gender identity, your experiences, and your care. And at the same time, a lot of people who are seeking trans services, even if they know what their gender identity is, may still be at a point of exploration of, okay, well, what do I want my expression to be? What feels natural to me? What does gender mean to me? And there's also fluidity. The way you may feel today, or even this morning, may not be the way you feel later on when it comes to some of those things. Even if your gender identity remains solid, some folks are gender fluid. So one of the things I would recommend is accessing NJCRI. They provide support groups, mental health counseling, job help, and other services. They can be a good resource to start. I don't know if specifically they have someone who can provide a letter for top surgery, but given what their focus on with the LGBTQ Pride Center there, the focus on making sure that folks have access to services, they more than likely will know a good place to refer someone out to. And also with the age of the person, check out Hetrick Martin Institute. They're LGBTQ focused. They work with folks who ages 13 to 21, and they provide counseling.
I don't know New Jersey very well, so I'm sorry I don't have anything to add.
That's okay. Awesome. So it is 5:51 now. So maybe it's time to transition to our closing question. So let's do that. So if anyone has any questions that they have, but didn't ask in the moment, or if you are watching this on YouTube after it aired, and you have any questions, please feel free to email lgbtq@mpl.org, and I will follow up. So for our closing question, I wanted to give our speakers the opportunity to share their creativity and imaginings for a better world. There are so many systemic problems in the current systems of healthcare and mental health care. But as Miriam Kaba says, hope is a discipline. And I, choose every day to believe a better world is possible. So the question here is, in an ideal world, what systems of care do you imagine?
I love this question. In an ideal world, if the world were perfect, nobody would oppress anyone. We would all be able to access empathy all the time for fellow people. However, since we live in a human one, I'll talk about an ideal world in a human sense. So ideally, a person would be able to say, hey, I can get as many therapy sessions as I want. I can get mental health services that may not necessarily involve therapy. All I have to do is go to this place. It is accessible for folks with disabilities. It is accessible for people who live in economically marginalized communities. It has professionals that understand oppression against various sectors and who are always learning, because I think that we must always be on guard about how oppression can present, even in new ways that may exist tomorrow that don't exist today, and be able to walk in there and say, hey, I can meet with a professional that looks like me. I can meet with a professional that has identities that I share. I can meet with a professional and not have to worry about paying a single dime. And I can meet with a professional that is going to treat me with dignity and respect, which should never be negotiable.
This question has sat with me like so profoundly since I read it. So thank you so much for coming up with it. And I've also found, my imagination tested by the limits of reality as well, knowing, what I know about systems as they exist. First I would sort of consider that, what falls under a system of care isn't always just, the formalized mental health relationship as well. That, easy access to safe and stable housing is such a big thing, to be able to, have one's own space, to be able to get out of unsafe settings, all those kinds of things that maybe aren't traditionally thought of as a system of care, but are an integral piece of what happens in mental health work. One way to think about it is you have to put out the fire before you can start new growth. And a lot of what unfortunately happens in therapy sessions where people might be in constant crisis is that there is a systems issue that just isn't going away, be that, racism, be that, violence between partners, things like that aren't so easy to just, wave a wand and have that go away. So recognizing that those aspects, food security, those pieces are huge, in being able to get to the point of, okay, let me sit down and let me actually work on, my mental health piece. Let me actually work on recovering from my trauma or healing from it, and not just surviving it. Those are things that I imagine as prerequisites. And then after that, basically everything that Lazora just shared is totally, having so many more of us out in the mental health professions, where there is no gatekeeping to what it takes to become a professional, whether that's in the form of tuition or degrees, or, recognizing that lived experience and lived expertise is such a big part of what makes us good in this work, and able to work with clients who, look like us and have backgrounds that are similar to us. Really bursting open those floodgates. Those are some of what I really imagine.
Your answers fill me with so much love and hope. Thank you so much. I really appreciate all of what you had to say, both of you. I wanted to thank you both so much for joining us tonight. This was an absolute pleasure. I always love talking to you each and both. And I super enjoyed all of your thoughtful answers. I'm definitely, this is being recorded. I'm going to go through it and write down all of the different resources and materials that you mentioned here, so they're available for anyone who is interested. And hopefully we'll have this program posted on YouTube, within the next week or so it's accessible for folks. But I just, this was wonderful. Thank you both so much. I really have appreciated this conversation.
Thank you for having us.
Yes, this is delightful and so important. So thank you for the opportunity.
Absolutely. So in closing, right after this program in 2 minutes at 6 p.m., the James Brown African American Room of Newark Public Library is presenting a panel called Juneteenth in Tulsa, From the Past to the Present. And they'll be discussing the history and future of Juneteenth and the 100th year commemoration of the Tulsa Race Massacre. If you are interested, you can attend by watching on Facebook Live on Newark Public Library's Facebook page right after you close this window. It'll be starting up very soon. And whether you attend that other program or not, I am wishing everyone to have a wonderful night. And thank you both to our speakers and attendees for your presence and your energy here. And I hope everyone takes care of themselves and each other. And I hope you all have a wonderful evening.